As CEO for Family Nursing and Home Care, I think this is a really unique opportunity for us to be able to build a new care model for the future of Jersey. We've often talked about partnerships and especially collaborating across the voluntary sector, and I think we've got a real opportunity to make a difference and add value to clients. We have a really vibrant voluntary and community sector, and some of the charitable organisations are all beginning to come together to work together. This should produce a really large resource, and we need to make sure that that's used really sensibly and that there's no duplication across the system. So I think, again, we've got an opportunity to collaborate, to build new partnerships.
Yeah, there's a very close link between people being physically active and the impact that has on them maintaining their physical health, but also more importantly in some cases their mental health and well-being as well. Yeah, well, we're working very closely with the review team who's looking at the new care model to make sure that physical activity is not only used as a way to help people who are already experiencing some life-limiting illnesses through the GP referral programme, through our work with people with a disability, but also, and more importantly, we're looking now at how we can make physical activity part of a prevention programme and pathway so that we can have the interventions much earlier before it gets to the acute clinical stage.
If we can get this model underway, the benefit to the community will be huge. Pathways will be made a lot easier, therefore the community will have access to services in a lot easier, straightforward format than what they probably have access to now, which can only be a good thing, and from a best practice point of view will be a wonderful example to the rest of the United Kingdom. I think under the new care model there's a huge opportunity to be able to transfer a number of services out of acute settings into the community. It makes total sense in the best interest of the clients, the hospital, the health service in general, for individuals to receive services within the community as opposed to in acute settings. Having been involved in the sector for the last 10 years, I can honestly say that this is the first time that I feel confident that there is going to be positive change in respect of this new care model. This is something we've been talking about for many years. However, for the first time I can honestly say that we're actually starting to see action. And I hope that continues.
We know that in any year 1 in 4 of the population will experience mental health problems, and that's why it's really important that investment is made and that mental health services are given parity with physical services. We're very encouraged that there now is a plan that's emerging which really does give mental health parity with physical health, because we've campaigned for a long time for the island to recognise the importance that we look after our mental health just as we look after our physical health. We need to recognise it's an all-island approach, and that mental health is about more than the services provided. It's about others playing their part, be they employers, schools or colleges, and the voluntary and community sector has great potential in being able to work in partnership with government agencies, and that really is the only way we're going to crack this.
There was a time when end-of-life care was very much considered the preserve of charities like hospice. That's no longer the case, and rightly so. It's something we're all facing, and seeing the care of people through chronic disease management and at the end of life being part of a much more integrated system is exactly what it should be.
Rapid response and reablement will be able to deliver more care and safe care, and it will also provide islanders with a choice on where they want to receive their care.